Kath, welcome to Hanson Career Connect. How are you doing today?
I am great. It's a good time to be here and a great time to talk to you about personal support workers, one of my favorite topics.
Thank you so much for joining us today, and we are also very lucky to have you with us. Let's start with origin of your story. You always mention about your aunt and her gift of the book to you, Go Do Something Great, which was pivotal in shaping your career. So, how did these experiences led you to focus on hospice, palliative care, and education?
Well, so I was raised by my aunt from the time I was 11. And during that time, she cared for her father. She cared for her mother and father-in-law, for an aunt and an uncle, not necessarily in our home, but helped them wherever they were. She also cared for neighbors and for friends who were ill. And I learned that when people are ill or when they're sick, that you respond. And I became comfortable with that. And I also think that because of her comfort with responding and her very matter-of-fact way about that, I think that helped me be comfortable. I think that many of us have a bit of a curiosity about death and about dying, and we want to participate in times that are important. And so that resonated with me too. And then by the time I was about 22, then I went into nursing. And when I graduated is when she gave me the book, Go Do Something Great. And I think actually it's called Go Do Some Great Thing. And I think it's about the Black pioneers in BC, including on Salt Spring Island. And I hate to admit, but I'd never read the book, but the title always stayed with me. And I think for me, it was her mandate that life is not a spectator sport, that we need to engage and we need to participate, and that we are needed, that our contribution is needed. And I think for me on a very deep spiritual level, it is really important to me to think that I am needed. I don't need to be special, but the fact that I'm needed and that I'm useful is really quite special to me.
And how did you bring that passion into education?
Good question. When I started working at Victoria Hospice in the late 80s, I realized that had I had some more education, that things could have been better. So I think somewhere in there between the Go Do Something Great and the experiences and my love for teaching, I think I just knew that education could change things. And I do believe that education can be an incredible catalyst for improving care. It's not the only thing to improve care, but it's one of the things. And I was committed to the idea that both individuals dying would be better cared for, but I also hoped that individuals providing the care would feel more comfortable, more confident, and be more able to provide excellent care. And in that way, increase the quality of life for both the receiver and the giver.
And when we talk about caregivers, caregiving requires not just skills, but immense compassion and resilience. What's your advice for caregivers to stay strong emotionally and professionally?
Well, a few weeks ago, I heard Lucy Hone, spelled Hone.
Mhm.
I heard her speak at the BC Hospice Palliative Care Grief, Bereavement, and Mental Health Summit. She did a wonderful webinar in about 2019, not a webinar, she did a TED Talk her on resiliency. And she talked about having studied about positive psychology and about resilience. She thought, when they were asked to help the US military become more resilient and mentally healthy, she thought, oh, this is why I've studied this. Then she returned to New Zealand and she was there when the huge earthquakes hit Christchurch on the South Island in New Zealand. And she thought, this is why I've studied this. And then she said it was a few years later when they were on their way on a family holiday and her daughter went in a car with the daughter's best friend and the mom, who was a good friend of her, of Lucy's, and they went separately, and another car went through a stop sign, didn't stop, and killed all three of them. And then Lucy said, this is why I have studied. And she thought Now I need to take what I've learned about resilience and adapt it to my own life and to this experience of grief. She said, is that it's important for us all to realize that bad things happen, that life is full of challenges. And I believe this so strongly. I believe that we come to earth and we experience life spelled capital L, capital I, capital F, capital E, not small case life. We come for the whole enchilada. We come for the whole meal deal. And that includes the good, the bad, and the ugly. And it includes suffering. It includes times of joy. And I think that as caregivers, it's really helpful if we realize this truth also, that we are here and that we care for people through hard times. I think it's really helpful when you're working as a personal support worker and you are caring for people who are declining in their health. We want to help them increase their strength and their endurance and their independence when appropriate. So that you've had a shift, you think about it, say on your way home, whether you're walking or busing or driving, and you think about what happened, how did it go, what were the good things, what went well, what didn't go well. And of all of those things, how did I navigate that, and how did I feel, and how did I feel inside, and what was my agenda, and when was I really in tune, and when was I less in tune, when was I really thinking about the other things on my agenda, when was I worried more about myself than I was about the person I care for. So I think having a reflective practice is really helpful. In the Life and Death Matters materials, each chapter looks at reflective questions to begin with. And what do you think about this? And what's your experience been with this topic? And what does a good death or a bad death mean to you? So really, really helpful to develop, and not only to use it within this sense, within the workbook and the Life and Death Matters textbook on integrating a palliative approach, essentials for personal support workers, but really helpful that you do this just within your practice. I also think it's really important to have, and not just I think this, but research has shown that it's really important to have a good support network. People that will cheer you on, people that will help you see opportunities for growth and for learning. I think another one is to have a self-care plan. And one of the things we did in particular with this last PSW text was have people develop a self-care plan. So not just today, Hardeep, when you go home from work, what things might you do in the coming days and weeks to keep yourself strong and healthy?
You have developed resources that make complex caregiving concepts accessible. Those who have taken NACC Personal Support Worker Program are very much familiar with your resources. Can you share how do you simplify a difficult topic to support learners?
Well, when we did some research in 2013, and at the end of that, we decided that we would separate out the nursing text from the PSW text. And I thought that there were a number of people that were PSWs. We needed to have the materials edited for plain, simple language. I felt like we needed to hire an artist to help so that it wasn't just a bunch of words like a dictionary, that it was more inviting, that we have a graphic designer who could design the book so it didn't feel heavy, that it felt a little bit more spacious. So those were a couple of the things. The other thing is I really do like plain and simple. And though I love research and I love to spend time, sometimes I like to spend time in research and trying to identify what does this mean, and what are these results, and what does this mean for my practice, and how can I integrate this in my practice. But when it comes to learning something new, I really like simple, and then I can go on to more complex. So I believe that simple is good. So things like in each symptom that we discuss the common symptoms that are experienced by people. Sometimes using analogies can help, and using stories. We've integrated stories throughout to try and help just bring those stories, bring that symptom or issue to life.
Balancing family and career in healthcare is no small feat. We all know that and we all admit that. But you have raised 5 kids while growing your career. What's your secret to balancing personal and professional commitments?
Oh, well, first of all, I have a really, 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 really supportive husband.
Yeah.
And he had a government job, so he was kind of a Monday to Friday.
Yeah.
So that permitted me to work, say, Saturdays and be able to do that. And we had some, he had some structure, so that was helpful. But and the kids were supportive, and I think it was helpful that I was doing something that has such meaning versus out earning money, which is important too. But the fact that there was so much value in what I did, I think helped me and it helped the rest of the gang. I also can remember that each semester, each new season, I found myself reevaluating, trying to figure out what were the needs of my family, my needs, what were the needs of my employer, and trying to figure out how I could balance them. And there were times when there were jobs that came up that I so wanted. And there were times when I cried because there were jobs that just looked so exciting and but they just didn't fit for our family at that time. And so I said no to them. And I think the ability to say no was good. And then, but what was interesting, Hardeep, is that over the years that I developed a different skill set than other people did. And that helped me in the long run with developing Life and Death Matters. So I think prayer, prioritizing, um, willingness to work hard, the desire to meet the needs of our kids while meeting the needs of the community. But there was a time when I was pregnant with number three, and I thought, if work keeps pushing me, we were living in a smaller community. If they keep pushing me, then I'm going to quit because I can't say no. I have a really hard time saying no. And so then in the end, I ended up probably quitting a month or two earlier. And then, and another way, when we'd had our fifth, he was born in December, and the head nurse called me in January and asked if I could come back. And I said, well, I can't do this, and I can't do this, and I can't do this, and I can't do that. And she said, okay. And I thought, don't kick a gift horse in the mouth. If she's willing to take me back on these terms, then I'm going.
Yeah.
And I so appreciate colleagues who did not throw mud and allowed me to work in a way that worked for me. Similarly, years ago, I was working, doing some scheduling for shifts. There was a woman that needed to be off by a certain time. And I mostly had it so she could be off by a certain time. But there was one day in the month that she had to be off an hour later. And she said, no, I can't do that. And I was kind of frustrated. And and then I redid the schedule and I was able to do it. So she was off earlier. And and that was a lesson to me also because I years later I sure appreciated her ability to say nope, can't do it. And I have a feeling I don't know if she was a young mom or if she was a grandma doing childcare. I have no idea, but I just know she was really very rigid, and I thought good for her. So I think we need to set limits. We need to be able to say no. We need a supportive family around us, a supportive team.
We at Hanson College, we're very excited to launch personal support worker program, and there is so much demand from students. Can you share from your experience what makes personal support workers so vital to the caregiving ecosystem, and how do they differ from other healthcare roles?
Well, that's a question that we could spend days talking about, I'm sure. But first of all, I sometimes say personal support workers, they go to places no one else goes,
Mhm.
and they stay longer than anyone else stays. They witness things that no one else witnesses, and they
Yeah.
become the confidants. I often think about when people go into a merge, and you think about the training to be a great emergency department nurse or physician or social worker. They're doing the personal care. They're seeing things. They're seeing and witness changes. Personal support worker does a unique job and such an incredibly fulfilling role.
The personal support worker field has evolved significantly. Could you share some of the biggest changes you have seen and your vision for where the industry is headed in the next decade?
When I did my very first shift as a home support worker, I went and had a cup of tea with a lady while her family member went out. So we've seen personal support workers take on more tasks, whether that's definitely all the personal care, but also maybe reminding to take medications or giving medications. And that can differ. The responsibilities and how that's enacted can differ depending on whether you're working in a facility, in a home, whether you're hired by an agency or whether you're working privately. So the scope has just changed tremendously. The numbers of people that require help is just growing, and as us baby boomers age, it's only going to continue. I think that we are going to see more PSWs getting together and providing care privately. And I'm excited to see the registry that's in Ontario that started. But I think we will see more regulation too. And I hope that we will see more PSWs in leadership roles. And I hope that we will see PSWs invited to all the care conferences and their voice being needed. And I hope that PSWs will really develop a sense of professionalism about their career.
And you mentioned a little bit about this already, but today, with Canada's aging population, the need for skilled personal support workers is skyrocketing. What opportunities do you see for individuals entering this field?
Well, I think we definitely see the need in facilities. We've got PSWs, of course, in long-term care and in residential care, independent living. We've got expanding roles in acute care and, of course, in home and community. And I think I see also a place where PSWs might start to take some of the leads and may, in fact, develop some of the businesses to help make this happen.
For someone who is considering a career as a personal support worker or in nursing, what are the first steps they should take? So, what is the one advice would you offer to those who are just starting out in this field?
Breathe deep, love it, grasp it, learn all you can learn. I think it is such a privilege. It is such a privilege to work with people and to work with them at such a difficult time in their lives, I think is a privilege. And so to learn all you can learn, to gain all the experience you can gain, to seek out experiences where you can continue to develop your practical skills, to find people on the unit who are just exceptional at what they do and asking if you can watch them, to have part-time jobs until you graduate and then to have jobs where you're valued. I just think it's an incredible thing to work in a facility where the personal support workers are valued. Sometimes as personal support workers, you'll need to take your resume and convince them that you're the one they want to hire who has the credential. I would want in a long term, I would want working in a setting where the team is healthy, where people care about one another, where the leadership wants your opinion, where the leadership wants you to have ongoing education. And so I think the more you commit to being a professional from the very beginning, so showing up on time, doing your homework, doing the studies, engaging, if you're online, if your class is online, keep your camera on, ask questions. If you're struggling with your English, do practice, take lessons, practice with people who are from different backgrounds so that you can get the accents so that people can understand well what you're saying. Develop great team spirit. If you're in a college with a nice small group of learners, develop those relationships, develop online communication groups where you can talk, where you can share ideas. If you see dishonesty, call it. If people are sharing assignments from the year before, call it. You're here to learn. You're here to gain. The school is here wanting you to succeed, and you want that for you and every other student in your class to be the best, not to be the best as in a one and only best, but you want everyone to excel. And I think to enter into that, and then when you meet with the individuals you're caring for, and when you meet with their families, to be able to look them in the eyes, to shake their hands, to say hello, to ask about them, just to embrace what you're doing. This is truly one of the most spectacular opportunities you'll have. This idea that the ground on which we stand is sacred ground. And I think that when we care for people, it is sacred ground. And if we only knew who we were caring for, if we could just see them in their fullness of their humanness, their goodness, their struggles, their sorrows that they've had, we're standing on sacred ground. So to embrace this profession with that kind of luster, that kind of passion, I think is wonderful.
That's very well said. And thank you so much for sharing all of that information. And I think your experience, which you have gathered for decades, is really going to help the future personal support workers or people in the healthcare industry. And now, with new training programs, mentorship opportunities, and a growing demand for healthcare workers, entering this field has never been more accessible or rewarding. And thanks to all the work you have put into this as well. So I must say this is a wrap for our podcast today. And thank you so much for sharing all the insights. And we look forward to hear more from you as well.
Thank you. And all the best to you and your team, and all the best with this exciting new program.
Thank you so much, Kath. For anyone looking to learn more about Kath's resources and the transformative work of Life and Death Matters, visit their website. Whether you're just starting your caregiving journey or looking to enhance your skills, there is so much value in what Kath has created. And if you're considering a career in caregiving or nursing, Hanson College is here to guide you at every step of the way. Explore our personal support worker program and connect with our admissions team today for more information. Stay kind and remember the greatest impact often come from the smallest, most compassionate acts. So stay kind.